the only sector of the economy in which the consumer has virtually no voice is healthcare. And you can tell that because instead of being called a consumer, they're called a patient. Now, the word patient means you be patient. My time's valuable. You're the one who has to be patient. So this kind of consumer unfriendliness in healthcare manifests itself in many ways in the inconvenience of the healthcare system, how long very busy people have to wait, in the inconvenience in how healthcare is packaged. So if you have a disease, let's say like diabetes, you do not have diabetes. You have diabetes and heart disease and kidney disease and ulcers and wounds that don't heal, and you're understandably terribly depressed, not only by this disease, but how hard it is for you to integrate all these people and get an integrated solution to your needs. So it's organized to the convenience of the people who provide health care rather than to the convenience of the consumer. And the consumer buys an insurance policy over which she has very little control. Her employer or the government chooses it on her behalf. So I coined this phrase, consumer-driven healthcare. I'm hardly a wordsmith, but I was looking for a phrase that would capture this idea that consumers should drive this system rather than be driven by it. Healthcare is among the only industries in the U.S. where productivity has gone down, not up. In other words, over time, we get less for our money rather than more for our money. Other industries like retailing, which are very consumer-driven, the rate of gain of productivity is astronomical. It's among the highest of all industries. So why don't governments and the providers embrace this movement? Because they're going to lose all their power. It's like, why don't dictator regimes love Facebook? Because, hello, they saw what happened in Egypt and other places in Libya and other locales as a result of consumers being empowered. So I don't think these people are venal or evil, but like all of us, they're naturally interested in maintaining the status quo if it works to their advantage. And right now, they've got all the power. The consumer, who's the source of all the money, but zero power. If I were part of the industry that got all the money with the funder having no power, I'd kind of like it that way and wouldn't be too wild to embrace changes to it. Willie Sutton was asked why he robbed banks, and he said, hey, that's where the money is. So if you want to make healthcare better and cheaper, the answer is healthcare services, because about 80% of our $2.7 trillion, an amount that's bigger than the GDP of China virtually, that's how much we spend on healthcare. 80% of that is spent on services, and they're very inefficient. So why haven't they been innovated? The reason is the way we pay for healthcare services. So we pay for services on a fee-for-service basis. So a doctor gets paid for every x-ray, every lab test, every vision, every visit, every hospital stay. She does not get paid for a bundle of care. So what happens as a result of that? There's a disease called congestive heart failure, dreadful disease. It costs hundreds of billions of dollars. It is the leading cause of unnecessary hospital admissions in the U.S. Everybody agrees with that. So why does that happen? It's because the people who manage congestive heart failure each separately get paid for what they do. They don't integrate with the other people. We don't have IT platforms that would permit them to do that. And as a result, the care is substandard because Dr. A doesn't know what Dr. B has done, and we incur unnecessarily high costs. What happens if, as an innovator, you say, this is stupid? I'm going to create an integrated bundle for the care of congestive heart failure. I'm going to eliminate unnecessary hospitalizations because I'm going to be so great at giving care. You're going to lose money because right now you get paid for those unnecessary hospitalizations, and if you eliminate them, you're going to lose money. How much money? So the Duke medical system, great system, did this. It integrated the care for congestive heart failure. In 1 year, they reduced the cost by $8,000 per patient. There's 6 million congestive heart failure patients in the U.S. Their innovation could have saved around $50 billion, quite a bit of money. Who benefited from their innovation? Well, the insurers benefited, the patients benefited, but Duke lost $8,000 per patient in revenue because it gets paid for every hospital admission, and every hospital admission it eliminated came right out of their pocket. Poor people in single-payer countries, they go to the back of the line because the people who are not poor, they buy private insurance to get out of the system that might put them in the back of the line. Switzerland, the poor buy the same health insurance as the middle class and the rich, and they're treated the same way. To the providers, they don't have a label on their forehead that says, I'm Medicaid, I'm poor. They come in just like everybody else. Now, where would we get the money to do this? Right now, Medicaid, which is our health insurance for the poor, in some states, it pays a doctor 60% of what she would earn from treating a person who has normal health insurance. Understandably, she is very concerned about treating people who are on Medicaid. She might have incurred up to $500,000 in expenses in medical education. So if we have the poor buying the same health insurance as the rest of us, right now their health insurance is much lower cost because the providers are paid so little for seeing Medicaid patients. Suppose we pay the providers the same for every patient they see. Well, I've simulated this, and I have found through simulations that have been run with a DC think tank that if we went to a consumer-driven system, we would likely not buy as much insurance as we do when our employers buy our insurance for us. For example, my employer, Harvard University, spends over $20,000 a year for my health insurance. $20,000. The median household income in the U.S. is $50,000. That's a fortune. Suppose they gave me the money. Would I spend $20,000? I would not. I would spend $15,000, $16,000, get a perfectly adequate health insurance that would cover me if I were in catastrophic need. And my $20,000, if they gave it back to me, I'd spend $15,000 on health insurance. Right now, that money is exempt from income taxes. It would remain exempt from income taxes. But $5,000 I would no longer spend on health insurance. That money would be taxable. How much in tax revenues would we raise? over $200 billion. That could go to financing poor people, as it should, and not putting them into a second-class system where a provider says, I'm sorry, I cannot treat you, I cannot afford to treat you, but would make them equal to everybody else when it comes to their purchasing power.